This morning, we are also going to speak on the justification and the recommendation of public holidays, allowances, and overtime pay for members of the protected services and nurses. Earlier this month, the Congress of Trade Unions and Staff Associations of Barbados submitted to the Ministry of the Public Service its justification for the granting of a public holiday allowance for members of the protected services and nurses, and for the payment of compensation for the hours worked beyond their regular shifts. It is the established practice that workers in other essential services are compensated for public holidays work and paid overtime where applicable. This is in addition to the any duty allowance, which also applies. The Public Holiday Act Cap 352 recognizes 12 annual statutory public holidays. Under the Shops Act Cap 356A, Good Friday, Easter Sunday, Independence Day, Christmas Day are designated as closed days. Consistent with the laws and practices, it is mandated that double pay applies for any holiday work. At a minimum, this is considered best practice under the Shops Act framework, inasmuch as the Shops Act directly applies to shop assistants. Many employers in various employment sectors embody in their labor agreements the payment of double time work for work completed on a public holiday. The observance of this is akin to fair and equitable treatment being applied. As it stands, members of the protected services and nurses are compensated with time off in lieu for working on public holidays. However, due to staffing shortages and operational demands, this time off is often not feasible. The granting of a lieu day, in some cases, is often inconvenient or not feasible due to staffing shortages, scheduling conflicts, or in the cases of nurses, high patient care and demand. In the instance of nurses either miss the day off entirely or are left to take it under stressful conditions, thus undermining its intended benefits. In the existing 24-hour environment, it is a standard that those who work on public holidays to receive the requisite compensation as stipulated under the law. Members of the protected services and nurses who provide critical and national service are equally deserving of equitable treatment and recognition. It is to be recognized that members of the protected services and nurses routinely forego family time on public holidays. And for this reason, the payment for work done on a public holiday is an appropriate way of recognizing their sacrifice and the value of the contribution for these categories of workers. Research shows that many countries across the globe, of which Australia is an example, provides holiday with pay or allowances to nurses as part of fair labor practices. When it comes to overtime pay, it is the law and practice for compensation to apply after a scheduled shift ends, unless flexibility is contractually specified. A clear distinction must, however, be made between the payment of flexibility allowance and overtime pay. Though the lens of Barbados' existing labor legislation, custom and practice, there is a clear expectation that double pay for holiday duty is a reasonable expectation of members of the protected services and nurses. Legal minimums and customary practice aligns with double time payment. Even where the Shaw Act does not directly apply, double payment is widely recognized in Barbados as a customary standard for payment for public holidays. This universal practice of overtime pay is cited in the case of Australia, where nurses are compensated with penalty rates for working on public holidays. These rates are typically double time and a half, which amounts to 250% of their standard hourly wage, depending on the specific award or enterprise agreement under which they are employed. Although members of the protected services and nurses are not covered under the SHOPS Act per se, they fall under a broader Employment Rights Act and collective agreements within the public sector. In practice, work on public holidays is often compensated at double time following statutory precedents and union negotiated customs. Overtime beyond standard shifts hours, or work week threshold typically receives time and a half pay, as is customary in other essential public services roles in Barbados. Where the adjustments are made to apply to members of the protected services and nurses, such will bring improved staff morale and enhance workforce sustainability. CTUSAB, in its submission to the Ministry of the Public Service, made some specific policy recommendations, and they are as follows: to legislate or mandate double-time public holidays paid for all members of the protected services and nurses. The introduction of compensation at 200% hourly rate for all hours worked to be applied to the 12 statutory holidays on the annual calendar. To develop formal criteria for applying flexibility time versus overtime. The integration of the policies identified above into the standing orders and collective agreements for all organizations, institutions fall under the protected services, and that again of nurses. It is the Congress's view that the implementation of these proposals will ensure fairness, compliance with the national labor standards, and that it would foster a more resilient workforce.
Hey, listen up, listen up. Listen up. National Trade Union Center, working for the good of all. National Trade Union Center, go where you know we got control. We working with